transgender women have one of the highest rates of HIV of any population in the U.S. By race, ethnicity, an estimated 44% of Black African American transgender women have HIV, compared to 26% of Hispanic Latina transgender women and only 7% of white transgender women. Despite the startling disparities, Black trans women are often overlooked and left out of the national conversation. This panel will cover some of the difficult conversations, including challenges in accessing HIV testing, treatment, and care, stigma and discrimination, as well as the resilience that is evident and needed through it all. Most importantly, this session will celebrate the triumphs of current movements that are happening virtually and on the ground that affirm that Black trans lives matter. I would like to start by introducing our moderator, Tori Cooper, who will also introduce the panel. Do you want me to read through the name? Okay, and I'm going to hand it over to you, Tori.
Thank you so very much. Good afternoon, everyone, and thank you all for coming back. I am kind of a straight from the hip person, and that's one of the reasons I hope that I keep getting invited back. So I will make sure that we kind of, I like to call a thing that is, all right? So we're going to talk about transgender women and our stuff for the next hour. Some folks have already tuned out. Some folks have already tuned out, all right? Some folks have already walked out. What I want to do is set the stage to let you all know that this is important conversation, all right? So I'm going to, I don't need to read my bio. It's on the app, all right? So that's not necessary. But what I will do is I will give each of these ladies an opportunity to introduce themselves, to talk about who they are and the work they do in their respective areas. But first, we'd like to open up with an icebreaker, okay? All right. So, very quietly, I would like everyone to look at the person who's on their left and the person that's on their right. All right? Now, I would like everyone in the room to look into the crotch of the person on the left and the person on the right.
Do you have any panties on?
So, the point that I'm making is each of us is treating the person that's on our left and on our right based on what we think is in their crotch. You assume that that's a woman or a man sitting next to you because of what you assume is between their legs. For many people, especially women, especially us Black women, yeah, I said us Black women, especially us Black women, is we have a tendency to believe that what I think is right and nothing else is. I am a Black woman. These are Black women, regardless as to what is or was in between any of our legs. Take your mind out of people's crotches. So, all right, so I guess you all can see this is gonna be a pretty good 55 minutes, right? But you have to go with us. This is a journey, and we wanna take you on a journey. So first, I actually have permission from Dr. Wyatt. Dr. Wyatt and I emailed each other about some stuff. She doesn't even remember. But we were invited to participate on a project together. I ended up not participating, and the project went well, all right? So with that being said, part of the conversation was about HIV transmission rates. And one of the things that I would like to respectfully respond to that you said in your introduction, Black women don't have one of the highest rates of infection. we have the highest rate of infection. You all, some of you don't believe that, but Black transgender women have the highest rate of HIV infection than any other community in the United States, period. Some folks still don't believe it, and I just said it, all right? And I have a college degree, and they still don't believe it. But if Dr. Wyatt had stood up there, you would believe it if she had said that, all right? So this is part of the conversation. We're gonna say transgender women, and then part of the conversation we're not. But I want everyone to understand that's who the focus of our conversation is. We are women. People will look at us first as Black women, or first as being Black, and then as being Black women, and then perhaps as being Black transgender women, all right? And there is a hierarchy there, and it's important to understand this. So this is just a small, and this is my portion of the email. I didn't think it was fair for me to use any of her portion without getting her permission before this conference. So it says transgender women have the highest risk for HIV infection of any other risk category, with Black transgender women being the absolute highest demographic, even surpassing that of African American men who have sex with men. So we were talking about risk. So the level of risk is different. The way in which a woman, any woman, contracts HIV can be the same. Some research suggests that lactobacillus in the vagina may protect some women from HIV infection. Correct. Am I right, Dr. Wyatt? Yes. All right, yeah, because my mom said, isn't a word. All right. So, yet the exact same behavior, when we're talking about risk for HIV, it has been said several times today that truthfully what we're talking about is behavior. The exact same behavior yields the same result as it pertains to HIV infection. There are no studies. That means there's a lack of data that indicate whether transgender women who have undergone gender reassignment surgery have the same protection. All right? That's part of, and one really last sentence from this. I also believe that continuous use of the word transgender is stigmatizing for some people. All right? We use trans and cis to differentiate between the path to womanhood. Simply that, all right? Those are public health terms. If I'm in Kroger, don't call me the trans woman, and I'm not gonna call you the cis woman, okay? All right. So I also believe that the continuous use of the word transgender is stigmatizing for some people. As someone on the call mentioned, cis women are not identified in general as being cis, and I believe that in many circumstances, the word transgender further separates women. Suddenly, we become the other women and not real women. Oh, some folks in this room have done it. All right, I have quite a bit of personal experience in that area. Certainly, some labels are necessary. It doesn't say this here, but it's important to be able to tell mayonnaise from horseradish because they look alike. So a label can be really, really important. All right? So that's just a little background information. So now we're going to get down to the good of it. All right, and I got permission to say all that first, okay? All right, so back at home, we've created a group dynamic, and this is how I'm going to allow folks, invite everyone to introduce themselves. All right, so one of the, and I created this, it's called I, We, You. I will speak from an I statement. I will say something from a we statement, which is people like me, and I will speak from a you statement, which is a charge or call to action, okay? All right. So, I am a Black transgender woman living in the South. We are experts in our own lives. Avail yourselves to learn from the experts, okay? You must realize that we are stronger when we fight together and not against each other. Okay? So with that being said, I would like starting at this end for you to introduce yourselves to folks. We're going to be pretty brief in the introduction so that we can get to the meat of it. All right, I know I took a little bit of time. So introduce yourself, tell people where you're from and what brings you here today.
Hi, my name is Camille Lewis. Can you all hear me? Yeah. Okay, good. Hi, my name is Camille Lewis. I'm out of Miami, Florida. I work at Empower You. I work at Empower You Community Health Center. I had the opportunity to start the only in the 33147, 33150. Those are the zip codes in the Miami, Florida area. Start a program for transgender individuals that benefit them. This month, September, we'll be celebrating 5 years of service, consistent service, no drop off, pick up, consistent service of transgender individuals. What brought me to the conference, my first experience of USCA was in Orlando last year. Fell in love with the conference. Had the opportunity to actually rub elbows and go beyond and actually have sit-down conversations with some influential people. That's why I had the opportunity to speak with Tori. And I said, please make me one of your mentees. And she gladly obliged. And then from then on, it was just upselling. And to be able to share a panel with Tori and with my sister here and my aunt Ivana, it's like I'm over here on cloud nine. So if I days off, trust me, I'm in part of the conversation. I'm just on cloud nine right now. So thank you all for listening. Thank you all for having me.
She's also the youngest on the panel as well.
Well, I didn't think that was important.
Back quite a few years.
Well, I am the youngest on the panel.
Hi everyone. I'm Ivana Cahill. I'm from Jackson, Mississippi. I'm known to a lot in Mississippi as Mother of the South. My mouth is unapologetic because I have been through so many trials and tribulations in my life, me being a longtime survivor, open living in Jackson, Mississippi with HIV. I had the privilege of starting a very small nonprofit called Love Me Unlimited for Life. We've been running for 3 years without any funding, and the funding has been coming out of my pocket. I don't get the acknowledgement that I should get, but I have the highest record of clients at one clinic that people don't talk about. And people slowly kind of discredit me about things I do and things I say and things I shouldn't say. But as a trans woman who's living with HIV, you can't tell me what I can and cannot say because you don't walk the mile in my shoes. Most of you can't walk the mile in my shoes, as y'all know. And this is a joke, as y'all know. Long story short, a few years ago, I'm a victim of domestic violence. I have a rod in my foot with nine screws and an iron rod. A few weeks ago, I suffered some health issues that caused me to carry my Porsche, which is my cane. But as y'all know, look at my feet. I still have on my heels. The joke to my heel success is try to walk a mile in my shoes. And we know most people can't walk a mile in these shoes that I walk around every day. Thank you.
Hey fam. So my name's Kiara St. James. I'm the Executive Director of New York Transgender Advocacy Group. We are a trans-led organization that addresses policies. I like to say that I'm a Southern expat. I'm originally from Beaumont, Texas, but I've been living in New York for quite some time. So I reside in the borough of Brooklyn, and I'm just really happy to be part of this conversation.
Yay! So, all right, so let's give our esteemed panelists a huge round of applause because we want everybody to feel welcome. All right, so we're going to get right into it, okay? So this question is, let's ask this question to you. So what does it mean when we say Black Trans Lives Matter, Kiara?
So when we say Black Trans Lives Matter, what that means is we need to be respected for who we are, who we identify as. It means that we need to make sure that we have folks who support us in our fight for equity and equality. It means that we need to make sure we're addressing violence towards Black trans women and that our cis sisters are not silent, but they speak up as well.
Thank you. So speaking up, is that just using words?
No, by action, by making sure that you are inviting Black trans women into these spaces. And I thank you so much for Black Women's Health Initiative for doing that for me. You know, I'm glad to be a part of the initiative. It's really an honor for me to be a part of that. And that's That's what I talk about when I talk about intentions and having, like, what is your intentions when you work with Black trans women? Making sure that you are inviting us into these spaces, but also that you're developing us. You know, too often what happens is Black trans women are used as outreach workers, and that's it, right? We need to make sure that we are developing Black trans women to be more than outreach workers.
Well, sometimes folks let us do tests too. They let us do HIV testing too. Sometimes. All right.
Sometimes, yes.
Keisha.
Thank you for that. All right, so this is a good one for Ivana. Ivana's in Jackson, Mississippi. I have to keep reiterating that point. Kiara has a really distinct advantage because she lived in the South and now she lives in the North. Ivana is at the heart of it. She is in Jackson, Mississippi. So, Ivana, people are data, and data is money.
Coins.
And there's a correlation between people and data and money. So tell us how a lack of data leads to a lack of money and a lack of resources for trans people, particularly trans women.
Well, the answer is right here. Me, you, and Kiara is part of the Transgender Law Center. We're on a Positivity Trans, and you would think Mississippi would have the data. No. Because we're still being recorded as MSM. I mean, we're being recorded. I mean, I don't care who toes I step on. I don't care who it offends. This is my life. My life. My life and my trans sisters and brothers. Like I tell everyone, if I die today, I have a legacy to live on behind me. And I teach my gay children that if I die, y'all got to continue on what I done carried on. Y'all got to stop worrying about who told y'all step on and who told you don't step on. This is not offensive. If you're not living with HIV, I promise you, you don't know what we deal with every day. Even me as a long-time survivor, I have problems at night, taking that pill every night. I had to pray about it every night. I never lost my faith just because I became transgender. I never lost my faith in God, and I'm still strong in God. But data in Mississippi is a hot mess. Even for the MSM, it's a hot mess because it's not collected like we're supposed to have it collected.
Thank you for that. You all can feel that. We can all feel that. I live in Atlanta, and data lacks in Atlanta, and the CDC is a stone's throw away from everything that we do. So data is a really, really big deal. And it is shameful and also sorrowful that it exists in the way that it does. And so what I encourage you, if you're someone who works around funding at your agency or whatever entity that you're involved with, if you're a person who works around funding, you work around grants, you're hiring people, make sure that you're hiring trans people, especially Black trans women, all right? If you go into a grocery store and you're the only Black person in there, you're gonna look at people like they're crazy. And people are gonna look at you like you're crazy. So if you're a place that serves folks, especially Black folks, then you want to have representation for the community. If you work with numbers and you work with money at your agency, first of all, it's the right thing to do, but also consider that it is a separate revenue stream, okay? So just keep those things in mind. So Camille, I would love for you to tell us a little bit about stigma, especially in a place like Miami.
Stigma in Miami is very difficult, and people will rather go unnoticed rather than to deal with stigma. And it's sad that individuals in Miami would have to not live their truth as my Aunt Ivana. Like, she's unapologetically Black. She's unapologetic about being a long-term survivor. In Miami, people will rather go and be in silence about that typical part of their life. At Empower You, we have a big picture glass window, and our agency is in the heart of where the Black community gathers, and that's the Northside Shopping Plaza. And to actually get someone to redeem the services that we offer, because we call ourselves the one and done, because you can get linkages care, we have an on-site pharmacy, you can go to your case manager, you can see your physician. We have it all there in one building. And to suffer with stigma and not want to walk inside of a medical center is shameful. Me working there, I was from way before even knowing anything about myself, walking through she got that shit. But when I began to talk to the community, I tell them, well, I may have that shit, but I'm getting paid to have that shit because I'm going to work every day. And that's what people fail to realize. And by me getting the knowledge that I have to give, I can come to you and talk to you with no harm, no foul, and no shame, because I'm getting the knowledge to disseminate to you to let you know just by touching that doorknob, there is no stigma, because we're also a full service health center. You can come in there for diabetes or dialysis or whatever, anything and everything in between. But the stigma in Miami is so at a high, it will prevent you from even putting your hands on the doorknob of a community health center. And for people to say that if they have it, we're all positive, positive like mentally, and people don't have any shame of walking into a medical center, I will beg to them and say, you're a lie. Every community have it. Every community have some type of shock or stigma at an all-time high. And by Miami being one of the fashion Bible Belts and all of that, and being one of the vacation cities, it's definitely at an all-time high. I'm not going there. What I'm going there for? And being black, we think that a cough drop or cough syrup or taking an aspirin and a Tylenol and taking a nap and drinking ginger ale and chicken soup, we think that's the answer for everything. So, yeah, in Miami, stigma is at an all-time high.
So here's a follow-up question, and you kind of touched on it. Can stigma kill a person?
Yes, it can, because stigma hinders your pride. Once you let down your guards and you say, well, if you have a faith, I believe in God. So if I'm like, even with my mouth and going into work, when I put my hand on that doorknob, God, whatever be will be, don't let me cuss nobody out of here today. That's my faith. That's me walking in my faith, and people should walk in their faith or whatever they believe in to walk inside of a medical center. God, whatever it is going to be, and be prepared. And I challenge all the people that work in medical centers and work in resources, be prepared to give resources immediately to let them know that they're not walking alone. So I'm grateful to work at Empower You. So immediately if we give you a positive, here it is. Yeah, drop a tear, but what's next? And one thing they taught us in 500-501 for testing, that we must, in testing and in this work, we must lead with empathy and not sympathy. Sympathy tells us, oh, you want me to take the HIV away from you? Empathy tells you, okay, what's next? And say it from a place of concern. So what's next? So what's next is we have test and treat. So before you go, we're going to get you treated. We're going to get you a pill down your throat. Yep, you got to swallow it, take it. Mm-hmm. Yeah, you'll be fine in the morning. Call me. And then we have case management. After case management, we have Willow. If you're MSM, we have the empowerment program. We're laying it all out there. That's where we're leading with empathy. So for anyone that is working in healthcare, lead with empathy.
Thank you. So,
If I may, right
yes,
quick.
because I'm going to ask you, how does stigma look different in New York versus Miami?
Well,
and
first,
then I'm going to ask the same thing of you.
Thank you. So first, I would like to say stigma also is like, I've been coming to a lot of these conferences for quite some time. In Black spaces, we have to be careful of how we assume that every Black person is from the church, has been affirmed by the church, and so we have to be careful in how we phrase things. You know, I grew up Kojic, Church of God in Christ, in Beaumont, Texas, but I've since transitioned to a more spiritual belief system. So I know that there's a lot of Black folks who feel uncomfortable in Black spaces. So we have to make sure that when we hold these convenings, that they are affirming of all of us. And so that's one of the stigmas that I feel I deal with a lot, is because I don't necessarily have that Pentecostal way of speaking. So I just wanted to highlight that.
So thank you. And before I go to Ivana, you brought up the church, and I was waiting for somebody to bring that up. All right. So church, for many people, so you go to church, people get married at churches. And the antithesis is people have funerals in churches. And that for people whom society deems as marginalized, many of us aren't going there to be avowed and affirmed. We're going there and are being killed with people's tongues and their looks, all right? In their word, their selective words, all right? Because the exact same book that talks about how folks are damned for being other than a white man who wore a dress, it's the same book. Nobody wore pants in the Bible, by the way. Let me make that clear. Conversation I had with my grandmother at 18 years old. Jesus didn't wear pants. If you find a picture of him wearing pants, you let me know. All right? So, all right. So that's the thing. So that's a very valid point. We talk about stigma, but it's important to understand the religiosity of the HIV epidemic, of which many of us are the assaulters, even when we don't realize it, Trina. All right. So stigma in Jackson.
Me, as being one of the house mothers of the largest family, which is the black family in Jackson, Mississippi, I have buried, I want to say 20-some kids from, I became house mother in 94. And from 94 up to now, even with now, I'm dealing with some situation with one of my kids now. Stigma. The person don't want to go and care because of who their family is, and we all know that Mississippi is a small town and we all know one another. And us as a community try to pull together, but sometimes we can't pull together. You know, I'm the thing about, we always talking about looking to organization to save us. Organizations are not going to save us. We will have to save ourselves. I'm speaking for the trans community, nobody else. I'm speaking for my trans people, what we talk about. We have realized, yeah, transgender is popular. Right now, in the epidemic in Mississippi, it's hot. All over it's hot. We're not stupid. We know it's about numbers. We know it's about things. But I'm the type of person, if you're going to do something for me, do it genuinely. I mean, do it from your heart. Don't do it just because we are popular right now. And my thing with stigma in Mississippi, stigma is a big thing. Even with my, I don't even like using the word cis women. I hate that word. Even with cis women in Mississippi, I'm slowly finding out certain people hit me up on Facebook or either see me in the store. Hey, can I get your number? Or this, that, and the other. They'll call me or text me and was like, you know, I seen you certain place. I want to talk to you. Like the other day, I was in Fashion Center, and this lady I had been knowing for a long time. She was like, I need to talk to you. I said, okay, sure. So she called me. She said, I admire you. I said, why? She said, I've been living with HIV for 10 years. I said, okay, are you in care? She said, no. I said, huh? She said, ain't no way I'm going in here in Mississippi. I said, we have several places we could take you to. We could sneak you in the back door. She said, no, ma'am. She said, people know my family. And she said, people who know my family is going to tell it. I said, baby, that's against the law. She said, I still don't want to go. But stigma is hard in Mississippi, and like everywhere else, but especially in Mississippi. That's why we have so much, that's why we're so high in rate in Mississippi, is because of stigma. People not being real with each other. I'm real as it comes. You can either love me or hate me. And I be glad, I'm more supportive of you hating me than you loving me, because I learned that from my family when I stepped away. Going back to your question with church, my family is, I'm not gonna get all the way in it. My family is very respected in Mississippi because of my father's position, certain things. And with faith, when my family turned on me, when I was 18 years old, my family turned on me. Only thing I had was my faith. I always knew what my grandmama and my father had taught me. But I took my faith and I made it turn back. I lost my aunt who raised me in April. And we all know in the Church of God in Christ, I can't come in here looking the way I'm coming into the temple and so I'm sitting on the front. That's a no-no. But those same people who criticized me and looked down on me when I walked into the temple and had strong faith back in April, those same people had to apologize to me and tell me, you're human. We understand you. We see you. We feel you. I'm saving a lot of people in Mississippi One of the known bishop's son, he had put me out of his church. God sent, I'm not gonna say that, but long story short, his son was diagnosed with HIV. The baby was going from HIV to AIDS status because he wasn't taking his medicine and wasn't in care. He reached out to me, I got him in care. He told his father what I did. That same pastor had to get on his knees and tell me please forgive him that he had sinned because he put me out of his church and didn't know why God had sent me to that church. And was the reason why God had sent me to the church because I can heal and deliver a lot of people that other people cannot reach. And I had to let my father know that. I could minister to people. My father had a problem with me becoming transgender because he said, you were supposed to be in line for the next male person to become a pastor. He didn't understand. I had a purpose and I had a mission. My purpose and my mission was, I'm going to be able to heal and deliver a lot of people that he couldn't heal and deliver in my trans mission.
That's good. That's good. So, we have heard death mentioned already a couple of times in various different ways. So, very briefly from each of you, let's hear a little bit about why suddenly, many of the people in this room are just hearing about Black trans women being murdered.
I can speak from experience, as y'all know. Google Misha Cotwell. Misha Cotwell was one of my babies. She was my roommate. I came very close with my transgender family and different people in reaching out to finding Misha's murder. Do you know you all, because of who I was and because of me being broadcasting on the news about we're looking for Misha the person who murdered Misha, I almost lost my life behind it. We sort of kind of know who did it. Her family sort of kind of know who did it. But and this came from one of her brothers. Oh, he was a boy that wore dread. So it didn't matter. You know, it's very hard. Even with a judge in Mississippi, goes back to 1993. Asia got killed downtown Jackson. We had a district attorney at the time, and it hurt my heart. She told one of my trans sisters' mother, well, we lost the case. I mean, we lost the files. We lost this. We lost that. Her mother got on the stand, and she testified. She said, I've been wearing this black dress since my daughter's funeral. She said, I'm still at a funeral. And I didn't like, what's she talking about? The funeral was, until you give me justice on my daughter's death, I'm still in mourning. Do you all know the district attorney told her? Well, because of statistic in the state of Mississippi, he, not she though, he was gonna be killed anyway. And at the time, I didn't understand. And people looking at me and be like, oh, she lying. These people don't talk to y'all like that. We catch hell in Mississippi. They don't care how they talk about
And Atlanta, and New York,
yeah,
Miami,
Miami.
DC, Southwest,
Totally different.
SOUF West. Yes.
Totally different. I mean, I was talking to a friend and told them maybe, well, I can release it today, so, because it's going to be released on internet so I have the honor and the privilege. We will be doing a documentary in Mississippi. I am the star. They're going to release it today. Press will release it today. I am the star of the documentary. They're going to follow me and my kids around. It's going to be like Pose, because everybody watch Pose. We basically did that in Mississippi. Everything they did, we did that in Mississippi except the ballroom scene. We did it on the drag scene of drag night, show night. That's how we were a mother to our kids. So I'm part of that, and I'm gonna take it back to the roots. Oh, I just not seeing who I have a homegirl here. Hey, Mata. I'm gonna take it back to the roots, downtown Jackson, where it all began, at Club City Lights. I'm gonna take it back to the roots of how we had to do survivor sex in order to make it, and from taking the survivor sex of the police officers, putting us in the back of the car, beating us, making us do oral sex on them, and taking the probably $20 that we done made that we haven't eaten in 2 days, but we had to go downtown to make $20 to feed me and the rest of the kids. And the police officer made you do oral sex on him, and he beat you, take the money from you, and put you out the car and tell you better not tell nobody because we're going to arrest you. It's real with trans life. Our lives are very important, and I thank God each day that my family is slowly realizing that I matter, because at first, I didn't matter to them. But now, my father calls me 4 and 5 times a day. Sometimes I look at the phone and be like, Daddy, what do you want? But it was once upon a time, he didn't speak to me. I mean, he didn't speak to me. He told me the other day, he said, I have always loved you, but he said, I didn't understand you. He said, and when he sees something about a transgender, he calls me. He still called me my other name. He still called me Terry. I'm like, yes, Daddy. I'm like, yes, Dad. He said, are you okay? Yeah, because he done called me 3 times since I've been here today. Where are you? Because I told him I went at the hotel. I had a previous speaking engagement somewhere else. We had to go. And I said, I'm not at the hotel. He said, well, you need to go back to the hotel where you're safe at. But, you know, I thank God for things like that. But my point is, people look at us crazy and they judge us, but y'all have no idea what we have to go through.
No idea
in
at all.
daily life. We have people sit up there laughing, grinning our face. Oh, girl, we down for you. You this, that, and other. And before you even turn out, even me, I had a friend girl who I loved and take care of her dear.
And don't forget, we have some other panelists.
Oh, I forgot. I forgot. You know I get carried away. You can go ahead.
You
No
see why they
mother's
keep hiring me, right?
No mother's house.
Clarifying question. When you think about your dad's response in the earlier days, do you think it had anything to do with his perception of his own manhood or lack thereof?
No, I think it's, my grandmother told me. So coming up as a child, everyone always knew I was different. Even my grandmama, when I came out to be trans and told her, she said, I don't even know why they got a problem. We already knew. I said, why you think say that? But
Grandmas know.
she said, why you think I taught you to cook? Well, I can cook a homemade cake and beat it up on my hand. A lot of people can't even do that. But my grandmama told me, she said, so you know, and even on her deathbed, she said, you know, the lifestyle you're living is not accepted in our religions. It's what he was taught from manhood to man. It's his man. Yeah, it was his manhood. From manhood to man, even though homosexuality do exist in Church of God in Christ, I'm not going to get into that from the high top up. But, you know, I'm real. But it was his manhood.
So what's interesting is, remember, one of the first, we all did an activity together, and we looked at people's crotches, and we identified each other based on what we thought was between their crotch. Sounds like your dad did the same thing, because he knew what used to be there, and so he only could judge you based on that. All right, so we live with this kind of stuff. I told y'all we experts in our own lives. All right, and each of you is an expert in your life as well.
People even ask us to take up what's down between our legs.
Oh yeah, they ask.
Can we see it?
At medical visits, at the DMV, at TSA.
TSA most definitely.
If we had some more time, I would tell y'all about the time that I sprained my ankle, and the guy asked to see my organs. So all right. So Bambi, if someone asked, could they see your vagina because you sprained your ankle? Now that doesn't mean I wouldn't do it. But you asked, was I insulted? And so here's the educational part of it. That's a whole different thing, right? Here's the educational part of it. So I am a trans woman, and I take estrogen. And do you all know, so the conversation when the room was almost empty is we were talking about hormone replacement. All right, so that's how my mom found out that I was taking a hormone therapy a long time ago, because we take the same thing. Mm-hmm. So sisters, if you take hormone replacement therapy, you're taking the same stuff that we're taking. Yes, no. So allow me to repeat that. It's the same stuff.
Talk about, I'm going through menopause right now. Y'all looking at me crazy.
It's the same stuff.
And I asked the doctor, she said, yeah, you're going to go through menopause because you take estrogen.
It's the same stuff. All right, same bottle, often the same prescription strengths. We get them from the same pharmacy. We might have the same insurance. It's the same stuff, all right? So stop thinking that we're like these creatures that just fell here from another planet.
Planet Neptune.
All right? So, all right. So, yeah, I'll tell y'all the story about the ankle if they pay me to come back next year, Valerie. Okay. Who said, oh, stop, girl? I have a mortgage. All right. So, how much time do we have left, Anita? Okay, all right. So we definitely want to open it up for some Q&A. Yeah, let's do that. Let's do that. Okay, I see 1, 2, 3 from the back to the front. The black hat is first.
My comment is to you. Yes. In your opening, you said something about the audience or people were living, etc., etc. You should not be concerned about that. Just be yourself. Don't worry about other people's reaction to you. That's their problem, not your problem. That's what. You know what I'm saying?
Thank you for your opinion. Yeah. I appreciate it. I believe it is well-intentioned. We currently live in a country where the president could give a rat's butt about what other people think. And how is that turning out? Okay? None of us lives in a world by ourselves. So, all right, none of y'all picked up my clothes, but I do care what you think. And as human beings, we care what other people think, all right? So that's what stigma is. Y'all know that, right? Mm-hmm. See how all of this stuff lined up? That's what stigma is. You're afraid of what somebody might think about your life. Real simple. Okay, so here and then here. Yes.
Cool. Related to the administration and the so-called president in charge, I work for a government grantee, which is fantastic, but it also comes with a lot of constraints in terms of what we can say and what we can do. So on grant reports, if I say I did this initiative for Black trans women, they will not fund me. That's the terrible thing of the matter. If I say like, hey, this was an initiative for Black trans women, they're like, no, thank you. The government. Yeah, we're government grantees. Yes. We can't even use the term marginalized communities. So it's very, very difficult to try to be a resourceful and responsible ally while still walking that line. And I was wondering if you guys had, or the entire room, had any sort of input as to how we could be the most effective and useful allies as possible while still trying to like not lose our money.
So first I would say don't stop.
DC. I'm
DC.
local. Yes, government grantees.
Oh my. So first I would say don't stop what you're doing and find alternative funding sources. That's number one. And then Kiara's gonna come and then we're gonna take the next question and keep pushing through.
So I reside in New York City. So one of the best ways that we're able to get funding is through discretionary funding of city council members. So that's one of the things you could probably cultivate here in DC is getting your city council members who you know are allies of the community to really award and issue you funding through discretionary funding sources.
Thank you. Eleanor Norton Holmes, great ally.
Hi. Okay, I didn't know if I was skipping someone. But anyway, I'm Jasmine Tasaki. So, yeah, I was going to hold on to the question. I was just going to say to you, grant prospecting is a big thing. So looking for the grants that will fund the kind of opportunities you're speaking of. And the bigger picture is making sure you hire trans women to work on your projects because that's going to get you funding automatically. Well, not automatically, but you're more likely to be funded if you have people from the community you're trying to serve working with your project. My other question, or first starts out as a statement. So we know that these conversations we have between cis women and trans women can sometimes be traumatizing for trans people, right? Because we come into the space and you talking about your ankle and they ask to see that, but that actually was a traumatizing situation. Although you've been able to find joy and laugh at that. My question for you all, because as a trans person that does this a lot, even now when I leave here, I'm out of breath right now just thinking about it, because as I'm sitting back looking, I'm like, a lot of y'all in here really don't know. Yeah, it's lighthearted now, but it's a big thing. So my question to you ladies is, how after sharing your stories and sitting on these panels and doing the work, what are the ways that you take care of yourself to ensure that you can push forward and continue the work and impact the community in the ways you do?
Thank you. That's good. That's good.
For me, I suffer from I don't give a damn-ism. So after I share my story with the mindset of it's going to inspire someone or someone's going to use it against me. So when I walk off this platform and I shake hands, I genuinely shake your hand. I genuinely thank you. I genuinely take your compliments. But in the frontal lobe of my mind, I don't give a damn what you think about me, because like Tori said, she got a mortgage. I got a car note I still got to pay. I still got bills. So when that per diem or when that invoice come in, I'm solidified. So I think, and being around strong women like Tori and Ivana Cahill, they also suffer from I don't give a damn-ism as well. And that allows us to walk with our head held high. Now, when I go into my room and I may cuss you out because you said he, or you may say something ignorant, that's just that. That's me unpacking when I get to my private place. And I'm able to decompress and detox and get it all out. It allows me to get back to the forefront and be that professional person that I've been rooted and grown to be. So I want to just, throw I don't give a damn-ism out to everybody else, and please move forward and walk in I don't give a damn-ism.
That's good. That's good. So I know we don't have much time. I'm looking for. Okay. Oh yeah, I love this.
So my question.
I hope so.
Sorry, my question is about dropping the label of trans. When I'm in the Black trans community and I call women, they're fine with it. When I'm in the white trans community and I call them women, they want that label. So when is it okay to drop the label? Is that just a white thing? And is their movement sometimes problematic to the Black trans movement?
So I will take this one very quickly and rather succinctly. So ask people. All right, because we could give you answers that apply great for our lives, all right? But I'm not a white trans person. I've never been a white trans person, and I do not aspire to be a white trans person. And so it would be inappropriate, I believe, for any of us to give you an answer that is definitive for white trans people. Okay? That didn't come off rude, did it? Great, thank you.
Hi, I'm Irvine, and I'm from Boston. And I want to start first by thanking you to share your stories. I hear the emotion that comes from that, and I really want to acknowledge what it takes to really share your stories, and I really appreciate that. I don't so much have a question, but more of a statement of really, I think for all of us, we need to really acknowledge how much stigma and shame is a form of control. A lot of times we individualize it in the person, but it's a power dynamic, right? And I think we have to look at that a lot more than we do, and not place it on the individual, but place it on the context and the the communities and the lives that we live. The one thing, just to answer the question a little bit from the person in the back, is that I also have targeted, prevention programs. And so one of the things that I do to involve other people is try to build in event funds into my budget, right? Because even though I have targeted programs, which could be for youth, all of that, I realize that for me to do that work, I need allies. And I know that the issue is larger within the community. So in doing the events, which is open to community, I get to engage people that is, that is outside of my targeted programs, and I get to connect and get to help and get to serve and get to build community where I am.
Thank you. So may I respectfully add something or take an educational moment from something that you said? Okay, see, I asked her permission. That's a good facilitation skill, folks. All right, so targeted. I actually bristled when you used that word. All right. Who here is from a family who hunts or somebody hunts? All right. So in order to kill your prey, you must first target it. All right. When we see words like target, when we present material that says targeting trans people, when we see that black people are being targeted by an RFP, that is very subtle and subconscious wording that implies that you're going to kill us. All right? Because if we were in a Walmart in El Paso, just a couple of weeks ago, the gunman went in there to target Hispanic people, particularly Mexicans is what he referred to them as. Okay? So part of meaningful engagement means changing the vocabulary. All right, I know that wasn't part of your initial comments, but I want to make sure that we're being very, very mindful of that. We're using words that are even more divisive and sending very subtle reminders of you're not wanted here, and if you come and take part in this, we really don't care about you. You know, we just want the money and we want to kill you. Okay? All right. So.
And actually, you just stole what I was about to say. No, I was going to mention, we talk a lot these days about meaningful involvement, the MEPA principles, meaningful involvement of people living with HIV and AIDS. And I've always talked about it has to be mindful involvement, not just meaningful, but mindful. So just wanted to hear from you regarding how would you describe meaningful or mindful involvement of people of trans experience in the work? It's not just hiring people. There's more to it than that. So how would you describe it?
So, we all know, and I'm going to keep it professional, we don't call names. We all know some people hire us just because we are transgender. To fill a quotum with numbers, or just because the grant required for you to hire me. But when your grant come in, I'm no longer part of your staff. My problem with situations I deal with is how are you going to be targeted? Well, listen to me saying targeted because that's what they were doing. How are you going to be dealing? I don't even want to use that word because they ain't doing it. How you say you are helping the trans community when no trans people are on your board. No people who are open living with HIV are on your board. Then when it comes to funding, you write the person in, and I'm not downing nobody who is illiterate, can't read or write. Then you put a person on there who cannot even bring you 3 people to the clinic to get tested. So stop hiring. Yes, it's you need to hire trans people, but stop hiring people just because the T is behind the name. Hire people who heart is in it. Everybody heart is not in the work we do.
So may I add, Ivana, token starts with a T as well?
Right.
Yeah.
Right.
No.
Token. Yeah.
Thank you.
Very briefly.
Yes. So one of the things, and I want to acknowledge my goddess who's in the room and who has inspired me to do this work. And I know she doesn't like me doing this, but Bolly White, to your right, if you can stand, goddess. So let me tell you why I wanted to highlight Bolly, because one of the things I talked about earlier is violence towards Black trans women and stigma towards trans amorous relationships. Bolly White, when she ran a department at Housing Works in New York City, she created spaces for our men to come and address their issues, right? So we need to make sure, and you need to make sure, that you're creating spaces for our partners to talk about issues that are impacting them. One of the main reasons why we experience the violence that we experience with our partners is because they don't have anywhere to go to really address those issues. So do your part.
So thank you, and we're gonna wrap up because I know they're gonna get me. So we can keep going. Yay! So all right, can I add a quick comment real quick? All right, so I will say, I will bet that none of you have folks who come to your site know women who contracted HIV through sex with other women. I will guarantee that hasn't happened, all right? With that being said, if there are a bunch of trans women living with HIV who didn't contract it from other women, and cis women who are living with HIV who didn't get from other women, is it quite possible that we're having sex with the same men? And stop trying to shame them, because it would be a prize to have either of these sisters on the stage, okay? Stop trying to shame them. All right, where were your comments? And then that's it? Okay. And then we're going to close? Great. All right.
Hello, everyone. My name is Robin Barkins, and I work at a community-based organization. I work with trans women and black women who are coming out of jail or prison 0 to 6 months. And I feel like the topic is never talked about, the social determinants of health that the women of trans experience face and black women face coming out of jail or prison with lack of housing. I'm a reentry client from 10 years ago, and they had a lot of resources for me when I was out. I'm HIV positive as well. But I know housing was one of the biggest factors for me to maintain, to stay in care. And right now in LA, we have a big housing crisis. And I have a transgender client, and particularly, I'm shaking right now thinking about this client because this client was released from prison, hepatitis C reactive, HIV positive, active IV drug user, and was homeless. So when we sent the client to one of the shelters, the client seen men there that triggered her. And she ran, and now she's currently homeless, and she recidivized again. Now she's out, and we can't even locate the client now. So, I mean, I feel like we have to start bringing these issues to the table about women in reentry, that are women and trans women who are coming out of jail or prison, and the social determinants of health that they face when they're coming out of jail and prison.
Thank you. So, and while she's moving the microphone, a comment was made by Ivana that we haven't talked about trans masculine persons and trans men. And that is very purpose. This is a conversation about black trans women. There will be many conversations there. But as we include include trans masculine people, suddenly an even bigger topic, particularly when you're talking about HIV, is reproductive justice. All right. And so that's a whole nother. All right. But it is a conversation that will be had more than once. So avail yourself to it. All right. Girl, you just over talking people. There was a comment on here. We're gonna get to your question, Bambi.
Ivana, you mentioned the documentary. You've just announced the release of it. Are you looking for investors for the documentary?
Well, I'll let you speak to the producers. I'll give you the information.
Okay.
Thank you, though. Yeah,
So address Bambi's question.
I got some things on the side that I need some investors.
We all need some investors.
We all need some investors.
Okay.
We all need some investors. Yes.
I'm trying to come to it seems like an oxymoron to me.
Yeah.
And that's why I apologize.
I want to answer her question.
None whatsoever.
I want to answer her question.
And we work together quite a bit and talk together quite a bit. So we both can talk. All right. So I want to make that part clear, and that's all in love. So, and if you're offended by the stuff that we say, then you need to check yourself. I want to make that clear too. All right. Because all of this was educational, and it was inspirational, and there was all kinds of stuff. So if you're in your feelings about anything that you heard today, then you need to address that with yourself. All right. It is very, very important. Because if you can't take with 4 women who are unaffiliated with you in any kind of way, if you can't take what we're saying to you in a spirit of education and empowerment, then how the hell are you going to help people back at home? All right. All right, so, yes, ma'am.
If I should be addressing my question to you or to you? Yes. Okay. I don't know. Don't clarify. We're in this space. We're in the Black Women's Health Imperative, and they have very intentionally made sure that we made space for trans women's voice.
No, we made sure that we made space. I mean, at that part, yes. Yes, ma'am.
saying what the fact that we're here in this place. Where's the space for trans men? Is it here? Is it with gay men? Is it if men are men and women are women? Then where is that space? Because
So, a very simple way to address that would be every place that any conversation is being had, simply because of one's transgender identity, and he's going to address this question more, but simply because of a person's gender identity has nothing to do with their sexuality, which in their sexuality or their sexual behavior is more, it has more to do with the level of risk for HIV.
still waiting. I mean, I've been to thousands of meetings.
You want to hear from a trans masculine person? Okay.
Still here. Where is that space that where you can demand that space be? Where is it? Because maybe I missed it.
So
All trans male.
there actually are some all trans male things on the agenda. I think it's like on Thursday, I want to say. But as a person who, let me see the best way I can say this. I also I have my own nonprofit that provides services to trans masculine. The name is Ubuntu Incorporated. That's UBUNTU. I don't want to take up too much space. But Ubuntu means I am because we are. I'm from Atlanta, Georgia, based out of Atlanta, Georgia. But we have this nonprofit and we exist because my wife and I started it because there was no space for trans masculine individuals. We couldn't find it if it did exist. And so we began to create that space. We also create a space for partners of trans individuals. In addition to having my own nonprofit, I work with a nonprofit organization by the name of He Is Valuable, which believes in reinforcing, celebrating, and uplifting the value of Black queer men. I'm the community services specialist. And as a Black man who is married to a cisgender woman, they have never made me feel anything less than loved, comfortable, and affirmed in that space.
We're creating a space. So if it wasn't for ladies like this, ladies who are doing the work for us, for him, then there would be no space. But we're constantly trying to get out there and to create the space for trans men.
Yeah. If I may
let me just one more thing. Earlier to your question, earlier you said how do we involve trans women in the process, and you talked about mindfulness and stuff like that. I want to again uplift Tori because she's been one of the biggest proponents, one of the people that has been very much yes, your voice is needed as a trans masculine voice in this work, in this space. And so it takes trans women, everything is built on their backs already. We're already constantly we stand on the shoulders of giants. I'm so grateful for you guys. Thank you for being here. Thank you for everything. But it takes women like Tori to say, yes, you can have your own nonprofit. Yes, I'll come on your board. Yes, I will teach you. I will teach you this process. That's what it takes. When you ask how you involve, yes, hire them as something other than a health educator and a tester. It takes,
Or as a token.
Yeah, it takes something else besides hiring them in those 2 or 3 positions, but it also takes when somebody makes it for them to reach back. So I just want to uplift that and thank you guys again.
Thank you. I just want to simply say that when we say trans women are women, it goes the same for trans men. Trans men are men. This is not a queer space. This is a women's space, right? So trans men are, should be in spaces for men to have conversations where they're addressing homophobia, transphobia, just like we're having that conversation in here.
So can we close on an I, we, you statement from each person? Great. So remember how I told you we do I, we. I saw your hands in the back. I did. But they haven't given me my check yet, so I can't just go off the grid. All right. I see it. Yes, ma'am. All right. So very quickly and very succinctly, give me an I, we, and a you.
I feel as if the words that I've said have resonated, and some of you all have some. I'll say some taken from my mentor because some may have checked out, some have understood, some haven't. I feel we can stand together, and we can get the information out, and I feel you all will be the best allies that you can be to trans women.
I will not apologize for nothing I have said. If I have offended you, oh well. Take it as a drop of water and let it roll off your back. We.
Whoever we is.
We must stand together as people. We got to stop depending on organization. And y'all might look at me crazy when I say this too. We got to stop depending on funders sometimes. Sometimes money is not everything. The Lord give and the Lord take it. And he will provide.
And what's your use statement?
My use statement is,
It's a charge, that call to action.
you. I'm not gonna say. Okay, I'll say it. You. I have one representative from Mississippi, Mata. I challenge you to give me a chance, and we're gonna stand together and make a difference in Mississippi. Thank you.
So, quite simply, I am more than enough. You are more than enough. We, as black women, are more than enough.
So I am thankful that you allowed us to use our voices. We know what we're talking about. Believe us, trust us, pay us. All right? A call to action is do more, require more, advocate more.